Well, thank you guys for coming. I know you had to brave the weather. It's Fat Tuesday, elections, there's a lot going on, so I really do appreciate you coming. A few background statements. One, when I was first asked to give this talk, I was reticent. It was not in my lane, so to speak. So when I got the task of giving this talk, I thought, I would much rather talk about disc replacement or ways to do spine fusion. But after digging into this subject matter, wow, am I glad I did this talk. Not only am I glad I did this talk, but I have something I will disclose at the end of the talk. I've had two very interesting things come up in my personal and professional life. It relates to this topic. So I'm going to bounce that off of you guys at the end of the talk. So listen to this talk, and then maybe you can give me your feedback, because you will see that in this small and candid, intimate arrangement, we can actually be confident and talk with each other about it. So anything that comes up, ask a question. So I'm talking about ethics in spine surgery. There will be no intraoperative photos. No one is going to see blood and guts. However, the subject matter may be triggering, and I apologize, but it's history, and history's ugly. I have no disclosures as it relates to this talk. Now, a little bit more about me. This is Brett Taylor at about 10 years of age. So I used to have hair. I rode horses when I started, about 10 years of age, and I have been an avid equestrian since. So I've had horses my whole life. This is my good friend Jill. She went to St. Joseph's Academy. She's an accountant in Carolina. We're still in touch. She sent me all these pictures because I never took pictures of it as a kid. And this is me counting money because I started to buy and sell horses. Now, anyone who knows anything about the horse industry, selling horses is an absolutely unethical business. There is no sense of honesty, and unscrupulous behavior is the norm. Little did I know from this kid in Bridgeton that I'd go to Harvard, Yale, come back and be a spine surgeon and realize, guess what? Spine surgery has some similarities. So, this is my academic history. I know in St. Louis, no one cares about this. All you want to know is, where'd you go to high school? Lutheran North. So I'm a Lutheran North grad. So what are ethics? Ethics is from the Greek word ethos, or character. There's no universally accepted definition of medical ethics. It's not science, it's not law, but it's moral principles that really determine a person's behavior and what's considered right and wrong. With that in mind, it is just what we think should happen, not necessarily what actually happens. And if you go back in history, even back in Mesopotamia, they had guidelines for how a physician or clinician should behave. And those guidelines even included pay, so the first fee for service, and medical malpractice. You lose a hand if your patient dies. That might not be a bad thing to consider bringing back. Now, Hippocrates was the father of modern medicine, and he talked about the Hippocratic Oath, which is a vow to only administer effective treatment according to your skill and judgment. But other cultures also have their own codes of ethics for clinicians and healthcare providers. Now, after World War II, with all the atrocities in World War II in the concentration camps, this Geneva and Nuremberg Code were developed for guidelines for human experimentation. And we will see, even though that occurred, we have still missed the mark a bit. So we're not done trying to sort this one out. Why do you study ethics? Well, you study ethics because this is rarely addressed. In medicine, it's addressed much more readily. There's more text about medical ethics. There's very little about surgical ethics. And initial surgical studies and activities were done with complete disregard of human rights. So it is an area that needs more attention. When you talk to a medical doctor and they say, my patient died, you might say to the medical doctor, well, what happened? Well, when a surgeon's patient died, you say, what'd you do? So that's the difference between surgical ethics and medical ethics. There is a big difference. So we have to, as surgeons, cause harm. That's part of the procedure. So it makes that ethical decision much more difficult. But we need to rely on high quality evidence science when we're making these decisions. Now, this is beginning of triggering stuff, guys. So I'm going to tell you a story. So I'm going to back up. When I was at Lutheran North, I had a wonderful teacher named Mr. Mack. He was a history teacher. When he gave his lectures, he would tell you kind of stories from history, and that kept you interested. So that's what I'm going to try to do. I'm going to try to channel Mr. Mack, okay? So Dr. Sims was a gynecologist, and there was a terrible problem that women were suffering from trauma during childbirth. And not to get on a bandwagon, but guess what caused more trauma? Doctors. So once they invented forceps, you had a whole lot more problems and trauma. And people would develop a terrible condition called a vesicovaginal fistula, a connection between the vagina and the anus, which was terrible. Especially, can you imagine in the South with no air conditioning and you have no bowel or bladder control and you're walking around? So it's a terrible situation. So Dr. Sims, who is considered the father of modern gynecology, but his methods were questionable at best. So he purchases 11 black women, slaves, puts them in a barn on his property, and he experiments on them. They perform lacerations, suture repair of their vesicovaginal fistulas. This is his statue coming down at Central Park, so you know where we're going, right? Not good. This is a picture that's supposed to depict Dr. Sims talking to, that's Betsy, one of the 11 slave women that he operated on. And you can see on the side here, these black women looking from the side. This is absolutely not a depiction of how this went down, okay? These surgeries, procedures, experiments were done without anesthesia, and ether existed. So that's messed up. They had to endure many, many, many procedures over 5 years that failed mostly and had to be revised. And not until Dr. Sims used a silver suture could he get these repairs to last and not have a terrible infection. Now, the white doctors who were his assistants, it is written in his own records, they couldn't tolerate the screams. They would leave. So the black women who were being experimented on had to restrain each other for these procedures. Another slave woman, Anarcha, who went through these procedures, had 30 operations performed in that 5 years. Just imagine the horror. So we'll just take a moment and look at Betsy because she's got no credit, and none of those black women got any credit for that. But let's just take a minute and look at her and just imagine what that would be like. And just as a sad side note, once he had developed the procedure, when he performed the surgery on white women, they got ether. So when I was a kid, I grew up in Ferguson. My grandmother would tell me all sorts of stories about the atrocities of what happened to black people in healthcare. And I have to be honest, I thought Grandma was a little, it's like, come on, Grams, it ain't that bad. You know what? It was that bad. She was undertelling the story. The story's worse than she told. I'm not going to go into it, but this is a textbook by Harriet Washington. If anyone's interested in learning more about this topic, please go to this source because it talks about the very long history of basically human experimentation that went on in the African American community. My great-grandmother would say something like, and it made no sense to me, but she would say, "Oh, I hope I die in the summer." Why does it matter when you die? Do you want to know why? Anybody? Any guess? There's no reason you would guess. So there were occupations called death doctors or a resurrectionist. And what those people did, because when medicine became more organized and cadaveric dissection became a part of healthcare, well, you needed bodies to do cadaveric dissection. And where did they come from? They came from the black cemeteries. So a resurrectionist was someone who was hired by the medical school to go dig up bodies out of the African American cemeteries for their dissection. One of the young girls who died in one of the bombings of the church in the late 50s, when they went to exhume her body, she was not there. And that's why, because this was so routine. Harvard Medical School, my alma mater, moved from Cambridge to Longwood to be closer to a certain community because they needed cadavers for dissection. This is something that is real. I'm telling you about it because it's not known, but I want to put that up there. And just something else, because I can't spend all the day on this, but anybody have any idea what a Mississippi appendectomy is? So back in the day, and Miss Sanger was one of the people, one who started Planned Parenthood, there was a big push for eugenics, which is basically, it's like breeding dogs. You know, if you want your German Shepherd to look a certain way, you breed it with the best looking German Shepherd. Well, she had her own thoughts, and a lot of people at the time, so I'm not throwing her under the bus, but a lot of people at the time had that same concept. It was also at the time of the beginning of the Third Reich, so there was a lot of people thinking about purity of a race. There was a lot of thoughts about different ethnicities coming from different lines that were not all human, but some come from this and some come from that. Mississippi appendectomy was involuntary sterilization. It happened in the South. People would go in for a procedure, and guess what? You get sterilized too, and they weren't ever told. There was no consent. So there's been a lot of bad things that have happened, but this is the next bad thing I have to tell you about. Anybody know about the Tuskegee syphilis study? Has everyone heard something about it? Most? Okay. Do you mind if I go through it, or do you want me to just skip? Move on. Go through it? Okay. So this is a study that was done in Macon County in the South. And just to give you a little background information, Julius Rosenwald, who was the owner of Sears and Roebuck, where I used to get all my clothes as a kid in the Husky section, but he owned Sears and Roebuck. They had a lot of money, and so he was very generous, and he worked in the South in the poor communities to do outreach and try to get health services to people. Because in the South, in the Jim Crow South, it was basically sharecropper environment. It's abject poverty and no health care. So he started a program working with W.E.B. Du Bois at Tuskegee, a historically black college, to do outreach for health. Now, all that was very altruistic and wonderful, but in 1932 there were some financial issues, so he couldn't keep paying for treatment. But the United States Public Health Service knew that there was a good relationship between the Rosenwald Fund, W.B. Du Bois, and this black community. In this black community, there was about a 40% incidence of syphilis in the community. And they thought, well, let's do a study on syphilis in this community. So what they did was they identified about 400 African American men with syphilis, and they got 200 controls, so it's 600 people. Initially, the study was designed to treat bad blood. That's what they told the men who were involved. Bad blood is a colloquial saying for something ails you. It's like the consumption. It's not a real diagnosis. It could mean anything. The men didn't know they had syphilis, but everyone doing the study knew, but it wasn't disclosed to them. So I guess I should tell you a little bit about syphilis. It's a mess. Syphilis is not like herpes or some of these STIs. Syphilis is bad news. So syphilis is caused by a bacterium, a spirochete, Treponema pallidum. When this infection occurs, you initially get a painless nodule. However, over time, that subsides, and then you can develop secondary syphilis, which is like a rash and body aches. Then it goes into a latent period, and after that is tertiary syphilis, and that is terrible. This can happen many years after your initial exposure, and that tertiary syphilis can include erosions of bone, erosions of soft tissue, absolute distortion of your figures. If you look online at pictures of people with latent syphilis in the early days, you will see absolutely deformed people. In your central nervous system, it can cause mental health issues, it can cause paralysis. In your cardiovascular system, it can erode your aorta and cause aortic dissection and rupture. So it's a death sentence for about 30% of the people who get the disease. And it's curable by penicillin. So this study was started in the 30s. We have participation from someone in the audience. Don, can I get your help? So, Don, this study started. How long after the study started and a cure for syphilis was discovered, how long did the study go on? A, 1 year, B, 10 years, which is a long time, or C, 25 years?
B, 10 years.
Okay, I'm going to read the question one more time. Okay. So, A, 1 year, B, 10 years, C, 25 years.
C.
25 years, yes. Can I get some help from my staff? Lori has been with me for 23 years as my nurse. She was hired to work with me before I left WashU. So I was in the Air Force when Lori started working with me, and she is still here working with me. So Lori is wonderful. You guys will get to talk to her. In your bag is a wonderful book. I will talk about that book after I finish talking about syphilis, all right? Because we got to finish this syphilis story. So penicillin was discovered in 1947. This study went on to 1972. It only stopped because a whistleblower identified what they were doing and reported them. Once that happened, all hell broke loose. There were lawsuits, blah, blah, blah. But I just want to tell you that, okay, I told you there were 600 people in the study. Let me tell you how twisted this was. When World War II broke out, some of the men wanted to volunteer to join the military. They were tested, they found out they had syphilis. The study intervened and said, no, don't recruit them, don't treat them. We want to keep them in the study. Not only that, they talked to all the local doctors in the community to make sure they didn't treat them for syphilis. Now you might say, because there's a lot of women in here, about their wives? Well, a large percentage of the wives develop syphilis. I didn't mention this, but syphilis can be transmitted through birth. Congenital syphilis is associated with mental disorders, blindness, all sorts of terrible ailments. 40 children were born with congenital syphilis during this time period of this study. So this is an absolute horrendous mark on our history as healthcare providers. And it's something that we really shouldn't forget. So because of studies like the Tuskegee syphilis study, we have IRB, review boards, to try to make sure that what we do in our research is done in an ethical way. And that's important. And even with that, there's still some unethical shit that goes down. We'll get to it. So the purpose of IRB is to try to safeguard people's rights. Now, the pillars of ethics. If you told someone I went to an ethics talk, there's some pillars of ethics: autonomy, beneficence, non-maleficence, and justice. This is one of the pillars, beneficence. It's doing the right thing. You want to try to do the right thing when you're providing care. But doing good needs to be well informed. You just can't want good things to happen, you need to think and have the knowledge to make sure that you're applying good science, good evidence-based science to get the right results. Non-maleficence is not do harm. It's hard in surgery because we do harm by doing an intentional violation of the skin, we damage tissues, but the goal has to be that the end point is worth it. As far as non-maleficence, patients are extremely vulnerable. They place their lives in our hands and they're unaware of what's being done with them. And this just needs to be taken more seriously by all clinicians. As it relates to doing the wrong thing, you can have, as a physician, both civil and criminal charges brought against you, depending on what you do, and we will see a little bit more about that coming up. So autonomy, it's a person's ability to make their own decision. It's self-rule. And this really comes into play when we're dealing with issues such as informed consent. But informed consent really has been bastardized. It's like a process, you write something down. Oftentimes it's done in the OR right before you go into surgery, which is insane. How can you, in your right mind, be in a position to really quantify and assess what's going on in that setting? So I think that the surgeon's role in informed consent is giving them the necessary information, and it's a collaborative process. It's not just sit down and sign this form. It really is an ongoing interchange between you and the patient, and that's the only way you can get good results. Now, I need more patient audience participation. Bridget? Bridget, hello.
Hello.
How are you?
Good, how are you?
I'm good. So I would like you to look at this question. So I don't know if I can stand here without messing things up. Now, in this situation, there's a gynecologist accused of horrific, sadistic mistreatment of inmates, abusive exams. He wouldn't stop exams. He would forcibly restrain patients, inappropriate sexualized comments. He retaliated against the victims. When do you think this happened? A, 20s to 30s, B, 50s to 60s, C, 90s to 2001, or D, 2016 to 2023. What do you think?
B.
So let's do it again. So A, 23 to 30, B, 56 to 64, C, 94 to 2001, and D, 2016 to 2023.
D.
D is right. Oh my gosh.
I would not guess that at all.
Why? Wouldn't you think somebody would be doing pervy stuff to prisoners like yesterday?
Right.
I mean, crazy. So can we get some help from my next long-term employee? Alyssa has been with us a long time, and this book, Crooked. So you guys were supposed to remind me about Radium Girls. Come on. So Radium Girls. Where do you start? Late 19 teens, like 17, 18 to the 20s. Radium is discovered. Radium is radioactive. It has an illuminescence. So back in the day, for some reason, people were lunatics. And they thought, oh, it glows, it must heal. So people did a lot of things with radium. But one of the things they did with radium was they used it to paint the dials of watches and military equipment so you could see the dial at night. And they hired young, teenage, 14, 15, young women to paint these dials in these sweatshops. And these dials were in the north, Chicago, Canada. And they hired about 4,000 women to paint these dials. Now, what do we know about radioactivity? It has a long half-life and it will ravage your body. The scientists who developed radium knew that. The women working in the factory were told it was safe. So safe, they were told, so that you can have a very small, tight point on your brush, we want you to stick it into your mouth. So they were instructed to lip and dip and paint. over and over and over again. That's how these women were exposed to extreme doses of radiation in their mouth. Their teeth started falling out. Then their jawbone started falling out. Then they started to develop terrible tumors all over their body. It's a great book. I'm going to stop there because everyone who reads, if they have any interest in this history, you should read the book. It's wonderful. Now, I'm going to tell you, it changed America as it relates to how America deals with occupational injuries and how America deals with women in the workforce. So these brave women and their very brave attorney fought a lot of uphill battles. And I will tell you, reading that book, the sycophant expert medical doctors who were complicit in the cover-up, hopefully they're somewhere warm right now, because there's nothing worse than that. What they did was absolutely inexcusable, and it really did change medicine. This book, Crooked, is written by an investigative journalist. She had a back problem, she went through healthcare, and she's like, what is going on? This makes no sense. She did a great job. Now, she doesn't make spine surgeons look good, so don't tell anyone I told you to read it. But she's spot on a lot of things. So I'm encouraging everyone to get that. In my process for informed consent, we include videos, we listen to our patients, we ask for their feedback, we actually kind of quiz them to see if they've been listening, and we also ask what their expectations are, because you can't provide satisfactory results if you don't know what their expectations are. It's a process that takes on multiple steps, so it's not one thing you do right before surgery. We have to do that at the hospital because that's how they do things, but my patients have gone through multiple discussions about their consent before then. On our team, we try to stay abreast of evolving surgical techniques, and we abide by a code of medical ethics, and we think that's important to provide quality care. There are a lot of barriers to consent. People rarely feel like they've received adequate information after they've gone through the process. It's also a big issue because sometimes patients don't necessarily understand what has been written, because people read at the level of maybe 5th grade, and you need to make sure you use terminology or videos or multiple modalities to do a very adequate consent. And this is just saying a lot of people can't read, and they won't tell you because they're embarrassed. So you really need to assess if they understand what's going on. You may need an interpreter, or there may be a rare circumstance where it's urgent surgery and the person who's being consent has a distracted injury and they need someone else to help them go through that process. Another story. I'm sure everyone's heard of Henrietta Lacks, right? HeLa cells? Okay. So this is another example of something happening to a person, their autonomy. She had cervical cancer, she had liver mets. They extracted some of her cells in a biopsy and found that her cells didn't die, they were immortal. And that cell line has changed medicine. There have been almost 11,000 patents from her cell line. And her family did not know that that had happened. And they didn't know until people start reaching out, asking them questions about donating blood, because they're still curious about the genetics behind that cell line. Eventually it was disclosed and a company had a settlement related to that, and I think Oprah made a movie about it. So you can watch that if you're interested. I need audience participation. Pamela, can you help me?
I'll try.
Okay. So I'm going to sit down next to you because I've been standing a long time. I'm really tired. So, Pamela, I'm going to go back because how could you recognize Henrietta Lacks so we're going to study that picture. Okay. Now, we're going to do a little experiment. Can you tell me which is Henrietta Lacks? And it's either A.
Yeah, I'm thinking.
Wait.
I'm thinking
B.
A.
Or C.
I'd say B.
B. You are right. Who's helping me? Do we have a gift? Who's helping me? Josh, okay. So I'm not going to expect anyone to guess who these two people are, but I have to tell you about them.
I thought I knew number 3.
Oh, no way, I should have asked. Well, let's go back.
Jazz singer, right? Yeah.
Yes, what's her name?
Who?
The jazz singer.
Billie Holiday.
Yes. Do you know what her name was at birth?
No.
Eleanor Fagan.
Okay.
And they also called her Lady Day.
Okay.
She took the name Billie Holiday because she was a fan of an actress named Billie Day, and her father's last name was Halliday, so it became Billie Halliday, but then it morphed into Billie Holiday. Before I talk about Billie, I want to tell you about Mamie Till Moberly. So, Mamie, 14-year-old son, living in Chicago, and he went to visit family in Mississippi, Money, Mississippi. So he's a 14-year-old boy. He had a stutter, and his mom had taught him that when you stutter, sometimes you can whistle to break your stutter. In the South, in the 50s, Jim Crow era, very different than living in Chicago as a black boy. There was an interaction at a store with the woman who owned the store named Bryant. She was about 21 years old. No one really knows what really happened, but she took offense, her husband took offense, so her husband and his half-brother went to Emmett's grandfather's home at gunpoint in the middle of the night, and they took the 14-year-old boy out. He was then brutally tortured and murdered. His wrists were broken, his femur was broken. He was tortured, then he was shot in the head, and then his body was thrown over a bridge into the Tallahatchie River with a 70-pound gin cotton fan tied around his neck with barbed wire. He was found about 3 or 4 days later, completely distorted in every way. But Mamie insisted on an open casket because she wanted America to see what they had done to him. And very shortly thereafter, a woman was sitting on a bus and she refused to get up. And it was Rosa Parks, and she said, "I just couldn't get up after what they did to that boy." So it really did change the course of the civil rights movement. Billie Holiday is I am a huge fan of Billie. Where do you start? So Billie was born in 1915, terrible family life, her just a mess. You picture terrible family life. Was kind of back and forth between a lot of different homes. She had some sexual trauma. She survived some childhood sexual trauma. She was as a little girl, sent to a nun's facility for wayward girls, and as punishment, they locked her in a room overnight with a dead girl. So she was tortured, but she overcame that and became this successful jazz singer. And she sang pop and jazz. Now, obviously, a person with that history, she also had some issues with drug abuse and opioid addiction. But one of her most famous songs is a song called Strange Fruit. Has anyone heard Strange Fruit? No? Oh my gosh. We need to get a Spotify. Josh, you have Spotify? Pull up Spotify, Strange Fruit. I'll sing along. I got the lyrics. We're just going all out. I'm laying it out there for you folks. This is going to be intimate. So let me tell you about Strange Fruit. It was written by Abel Maripol, and Abel was a communist sympathizer. You don't have to play it yet. He was a communist sympathizer. He wrote this poem. It was put to music, and she sang it. It talks about the violence to black people. It's a song about lynching. So that pissed off people in government, meaning our government. Hoover hated the fact that she sang the song. He hated the fact that she kept singing the song. So he had his agents come to her and pressure her in every way possible. Take her license so she can't perform at places where they serve alcohol. Make it so that she can't exist. But she still sang the song. She knew they wanted her to stop, but she wouldn't. In the end, at 44, Billie died in a hospital, chained to the hospital because she was forced to withdraw from opioids at the insistence of the officers who arrested her. But that song is still a popular song, and it's probably one of her most popular songs. As a side note, Abel Maripol adopted the kids of Julius and Ethel Rosenberg, who were executed for espionage, and they were the only couple executed in the Cold War. But that's my Billie Holiday story. Do you guys really want to hear me sing? Really? Okay, well, Josh, I'm going to do it without the accompaniment because I'll sound bad if Billie's singing. Okay. Deep breath. This is how intimate we are, guys. When was the last time a spine surgeon sang to you? No? No? Okay, all right. Southern trees bear a strange fruit, blood on the leaves and blood at the root. Black bodies swinging in the southern breeze, strange fruit hanging from the poplar trees. Pastoral scenes of the gallant South, the bulging eyes and the twisted mouth. Cinnamagnolia, sweet and fresh, then the sudden smell of burning flesh. Here is the fruit for the crows to pluck, for the rain to gather, for the wind to suck, for the sun to rot, for the tree to drop. Here is a strange and bitter crop. It's a very moving song. It sounds better when Billie does it, but that's the song, and that's the song that ended her life. She died because of that song. Josh, thank you. Did you give the gift? Yeah. Awesome, great. This has nothing to do with bad stuff. It's just a good story. It's about humanness. It's about a horse that was a horse racer back in the 1800s. Race relations a little. It's a great book. I hope you enjoy it. So let's talk a little about concurrent and overlapping surgeries. Does anyone know what that is? It basically means that if Pam's my patient, Bridget's my patient, Don's my patient, and you're all having surgery tomorrow morning at 7, and the surgery starts at the same time, and we have 3 different rooms, and I'm your surgeon. That's concurrent surgery. It means that a resident will be in one room, a fellow will be in another room. We'll all do your surgery, but I'm billing for all of you to have surgery. And it's just the norm a lot of times. When I was in training, it was the norm. My residency, that was the norm. It is just the norm, and most teaching hospitals do it to a certain degree. There's a lot of reasons why they do it, but there is some concern that it might cause more complications. And is it completely kosher? Because if the patients don't really know, it's not great. So the reason I'm telling you this story, because remember, this is going to be story-based, right? So we got another story. This man right here, that's Dr. Burke. These are 2 of my very good friends. This is Derek Jones. This is Steve Barr. They were my chief residents at Mass General. So right after them, I became chief resident at Mass General, and Dr. Burke gave me a wonderful picture of MGH that's up on my wall in my office. What happened was a doctor, an anesthesiologist, complained at Mass General that this was going on. Dr. Burke agreed with her. He said, this is wrong. He went through the proper channels, and the university basically told him, hey, get out of here. But he continued to fight, even when they put up a very strong resistance, to the point that he was so tenacious, knowing that this was an unethical thing that had to change, that he submitted records to a local newspaper, both to clear his name, but also to show that, no, this is going on, and they're not doing anything about it. Fortunately, he ended up being victorious, and he won. He was fired from his job after 35 years at MGH. They had to offer him his job back, and now they've changed their ways, and they definitely tell patients when they're doing concurrent surgery. So I tell you this story simply to say, if you're on the right side of an ethical issue, it may still hurt. It's not going to be easy. More likely than not, it's going to hurt a lot if you're the one fighting for what's right. I'm just going to talk a little bit about confidentiality, and the reason I think it's important is these electronic medical records. We get a lot of electronic medical records, and I would say on the routine, we have someone else's records interspersed in there. So we are always looking at the names to see, is this the right person? I think this is something that there's got to be a better way, but I don't know what it is. Anyone know about the Dr. Death podcast or the movie? If you don't, look this up. The podcast is great, and the movie's okay. It's like one of those mini-series things. I would say do the podcast, because everybody drives around in their car. It's a great thing to listen to. It will make you shudder. Unnecessary spine surgery. There's a whole lot of this that goes on in spine surgery, up to 70%. Why does that happen? Well, because people who are normal develop disc herniations and disc bulges and all of this stuff that the radiology reports say, but that doesn't mean there's something wrong with them. And when people have this condition, which some doctors call an annular tear, that's misrepresenting the facts. It's not a tear, it's not due to trauma, it's part of arthritis. So we don't use terms like a disc rupture or annular tear because it implies trauma. And it's disingenuous, and it doesn't help our patients because they think something's wrong with them when it's really more like gray hair, receding hairline. Okay, I need another volunteer. Okay, you were the one who told me to talk about Tuskegee. What's your name, ma'am?
Jennifer Gallen.
Jennifer, okay. Jennifer, I need your help. This is another question. Now, glandular rejuvenation was a popular procedure in the US and abroad, and it included which of the following? Can you see? You want to let's go up here. So I want you to see. I want you to see because you're going to get this right. I can tell because you don't play around. So, A, injection of spermine, and for those who didn't study, spermine is semen, calf's heart, liver, and bull's testicle, or transplanting cadaveric human testes into normal men, or transplanting monkey organs into people, or transplanting goat testicles into people, or E, all of the above. So, A, B, C, D, or E. What do you think?
I was going to say E.
High five! Way to go! Wow, do we have a gift? This is great. All right, so this is unreal, this story. So, gosh, a lot of stories, guys. Mr. Brinkley. How do I start with Mr. Brinkley? Well, he was born in Appalachia, and just to give you a little idea of his character, he was married with children, didn't like that, so he just left. And then he met another woman, and he married her. And she was the daughter of a doctor, and that seemed to be more his style. He liked it so much, he said, I want to be a doctor. So he acquired a medical license. And by acquired, I mean he acquired it. And then he began his practice. And his practice included buying a hospital in Kansas next to a little goat pen. And he would let people come, and for cash, $750 back in the 1920s, you could pick the goat that you wanted that was simpatico with you, and he would take that goat's testes and implant it into your body. And this was going to cure all that ails you. It was like the Viagra and the Cialis of the day, plus it just cured what ailed you. Now, those other examples are also true. There were doctors who were pulling testes out of deceased men in prison. There was a doctor in San Quentin who would acquire the testes of recently euthanized prisoners and sell them to another doctor who would plant them in people. This was being done all over the country, but Brinkley we're going to talk about because he's just a trip. And that book that you got tells his whole story. It's called Charlatan. But this is Brinkley with his wife doing his goat sham surgery. This is their hospital that they had, and you see it was there for a long time doing this. And this is kind of his demise. But before we go there, this is just his book. So this was such a big racket, and Brinkley made so much money from this that he started to do other procedures. And he thought, maybe there's other ways I can make money. So he started a radio station, And on his radio station, he would have people write in, he would read their letter, and based on their letter, he would then tell them what treatment. Oh, I've been bleeding and I need to do, and he would say, you need to buy this serum A and get these tablets B and this, and it was all a sham because he owned the pharmaceutical company. So he was telling people to buy sham treatments to treat real illnesses, and he was doing it all over the radio, diagnosing people over the radio. He made a mint. He had a 172-foot yacht, which he loaned to the Duke and Duchess of Windsor after he abdicated the crown. They closed his radio station, so he opened up a bigger and more powerful radio station in Del Rio in Mexico. This radio station was so powerful, at the time it was the most powerful radio station in the world. You could hear his music from that radio station in Lithuania, in Arkansas, so much so that Russian spies learned English from listening to his radio station. Now, in addition, because from Appalachia, he liked hillbilly music. So the Carter family started playing music at his radio station. And that music, because it stretched so far and wide, it touched so many young people who were influenced. Waylon Jennings, Johnny Carson, Chet Atkins. All of these stars were influenced because they lived wherever they lived, but they could hear this guy's music being boomed across the whole world. Now, he did have his demise because there was a very tenacious Journal of American Medicine surgeon named Fishbein who said, this guy's a charlatan. This is crap. We need to stop this. Because if we have people in America saying their doctors doing shit like this, it's going to be the demise of our healthcare system. It went on for a long time, but ultimately, in a legal battle, he lost because he didn't really go to medical school. He just bought his degree. He was never really a doctor. He was just a sham artist. But that's what put him out of the business, and eventually he died destitute. So this is one more sober note. This is serious, guys. This has nothing to do with ethics, but I couldn't give a talk without talking about this. We got to deal with this problem. Violence in healthcare. We just had in Pennsylvania, in an ICU, people held hostage and injured. And I put this slide up. This is Preston. He got killed in Tulsa, Oklahoma in 22. A spine surgeon. He went to Harvard. I knew him. He was a senior. He was my senior. We weren't friends, but I knew him, and he was a very kind person all the time I interacted with him. He was killed. This wonderful doctor was killed in Tulsa. They also killed a receptionist and a patient's family member who was there in the clinic at the same time. Within a year, Benjamin was killed in Tennessee. We got to do something about this, folks. This is serious. It affects all of us. We're not going to have good healthcare providers if people are afraid of being killed or injured. Final topic in ethics, justice. So we need to be fair, and this is important because, especially in spine, surgeons have a lot of ways to create other alternative forms of income. And I think the one thing I can say is there should be transparency. Doctors need to disclose if there's any conflict of interest and let the patient decide if they care. Most patients don't, but I think if people don't disclose, it really is unlikely that they're truly being ethical in their behavior. So conflict of interest is whenever there are two or more benefits from an activity and they may be discordant. I need patients in my study because I'm doing research and I want the industry to really like me because I'm filling my study. And this patient needs a surgery, but do they need the study surgery? But whenever you're tempted to bring those two together when they shouldn't be, that's when patient care is compromised. Transparency is essential, and surgeons really should openly discuss their financial interests. And I think some things that are being done in spine are really not good. Like, if you own a hardware company, you as a surgeon probably shouldn't be implanting that hardware. That's just my opinion. It just doesn't seem kosher. I think surgery centers are great. I think surgery centers can be wonderful places. And I personally don't think it harms patients that doctors have a ownership position in surgery centers. I don't have one, but I have in the past. I don't think it affects care, but I have to put it up here because it's something that should be disclosed. And if you're a patient having surgery there, you should know if your doctor has ownership there. This, I think, is not appropriate. It's a physician's own distributorship where the doctor drives up and gets the instruments out of his trunk and brings them into surgery. I think that's a little much. There's a lot of industry employees being embedded into healthcare. So this can be in academic centers, it can be in private practice, where the company that sells the instruments that your doctor's using has an employee on his staff working with him to do research or whatever he needs them to do. I think it's just a gray zone, and it's something I think that should also be disclosed. Royalties, a lot of people get a lot of money for their developments. I personally have sold intellectual property to big companies. In my experience, it was just a ruse to get me to use their products, and when I didn't use their products, they went bye-bye. But there are other cases where it's legitimate, and you are being paid for your legitimate work. I do think all that needs to be disclosed. So relationship with industry has changed because of AvaMed in 2004. Most of this information is in the public record. So if you have questions, you should look into that. And then let's just talk about, this is the walk of shame, some things that have gone wrong. This is a recent case where this gentleman, he's showing you that he plays polo and he's a doctor. So he has a stethoscope and a polo mallet. It's awesome. He only made $3.3 million doing surgery with kickbacks. Kickbacks are where Pamela tells me, bring your patient to my hospital, Dr. Taylor. If you do surgery, if you do ACDF, I'll give you $10,000. If you do me a lumbar surgery, I'll give you $20,000. I go, Pam, well, when can I sign up? That's a kickback. It's inappropriate, it's unethical, but it does happen. Another example, and it's not like everyone I went to school with is either dead or done something bad, but this doctor is another Harvard graduate, and he's accused of all sorts of illegal stuff, paying doctors to do surgery, and I'm trying to remember just what was written so I don't get sued, because he's the type who would. So all we can say is read up on it if you want to learn more. This is an example of a guy who was selling counterfeit hardware. This is the real hardware, this is the fake. The fake hadn't been approved by the FDA, but he was putting into people's bodies. So we're going to end with new technology. Not all new innovations are successful, and not everything new is good. Oftentimes new just means different, and optimally a spine surgeon who's competent should be able to assess the studies to see if it's really legitimate. I'm going to say that more often than not, this is what we see. A new idea, a lot of people say it's great. The people who say it's great might get paid to be consultants to do the research, and then everyone starts doing it, and when everyone starts doing it, we realize it kind of sucks, and then it goes away. That is Scott's parabola, and that's what we see so often in healthcare. This is the wave, and oftentimes the people who are saying it's so great at the beginning have some foot in the door, consulting agreement, royalties, something, and so it's just great, and then it's just not great, and that's unfortunate. So I think there are other things that are going on. This is not as bad as goat testes, but a lot of these stem cell treatments for cash, it's at this point not yet proven. And the reason I can say that is you're paying cash for it. You know, if it was legitimate, you'd be doing it through research, through your insurance. Not saying that insurance is great, they're terrible too. However, in this case, in the spine, this is not yet ready for prime time, okay? Other things that are oversold, anybody remember the Laser Spine Institute? It's gone. Do I need to say anything else? I think Hulk Hogan had something to do with that. He was unhappy with his results and sued them, and they had to go away. Other oversold devices, doing an X-stop. Anybody remember X-stops, Diom, all that stuff? You don't hear about it anymore, right? It's almost gone. There might be somebody somewhere weird doing it, but it's almost gone. IDET is pretty much gone. PEEK, it's polyether ether ketone. It's a plastic. It was everywhere. It's almost gone. You never see it anymore. So these are it's Scott's parabola. It's awesome, oh no, it sucks, it's gone. So that's just what we see. And I think lumbar disc replacement is in that family. It's not that bad, but it's in that family. Do I do lumbar disc replacement? Yes, but it hasn't changed healthcare like they said it would. It just hasn't. So is the innovation really an advancement? Efficacy is what we see when those first doctors do the surgery who are also stockholders and or consultants. But is it effective? That's when we realize the down slope of Scott's parabola, it's not really effective. When everybody starts doing it, it just doesn't seem to work that well. This is another documentary. I won't tell you about it, but it's out there on Netflix. Watch it if you're interested. I'm going to tell you some cases, and then like I told you at the end, I was going to tell you about some real life things that I need your help with, okay? So this is a case, a Jehovah's Witness who needed surgery. Jehovah's Witnesses don't believe in getting blood donations. So in this case, we had a very long conversation with them about some alternatives, like a cell saver where you collect their blood and give it back to them, or giving them some chemicals, antifibrillinic, that helps decrease bleeding, or erythropoietin to help them build blood. They came in with their religious advisor. We talked about it. We had a nuanced and detailed discussion, and they said, we're game with this. With this circumstance, are you willing to do the surgery? And we did the surgery, and it was fine. But that's how a nuanced, informed consent should occur. It shouldn't just be sign this paper and get out of here. You need to have a detailed conversation. Another patient, this is a young man who came in with a lumbar disc herniation, and I guess the take-home message is he had been an opioid addict, and he was off, he was clean. And he said, I'll do surgery, but I don't want any opioid even in my sleep while I'm under anesthesia. And I told him, I don't know if that's going to work, but more importantly, I don't know if you need the surgery anyway, because disc herniations get better over time. We did a big study, multi-center study called the SPORT study. I was involved in it at WashU. And that study basically showed if you don't do surgery and you do surgery, down the road, they're both the same. The only difference is if you do surgery, you get better a little faster. And you hope you don't get an infection or any of those other things that can happen with surgery. So there's nothing wrong with not operating on someone with a lumbar disc herniation. And then this is the final case, and this is more complicated, but this woman had had a major surgery unrelated to work comp. Her doctor sent her back to work after a 3-level front-back surgery in 3 months. I think that's crazy, but you didn't hear it from me. Oh, wait, you did, and I'm on film. Anyway, at work, 3 months later, she falls down. She has a bruise to her coccyx, but the issue is she's complaining about things that are unrelated to her coccyx. And I had to explain to her, ma'am, you are not fused. I don't know why your doctor sent you back to work, but you're not fused, and you have a huge fluid collection from the surgery. You need to go back to your doctor and get that addressed. But that's a complex situation where someone's coming under work comp. They are a patient, and I need to be honest with them as a patient and say, well, your work comp injury is this, but this problem is not work comp, and you need to go back to the doctor who started this. So, thank you. Now, I told you I had 2 things to tell you, right? So let's do this. I need help, all right? So first, this is a YouTube video. So I told you at the very beginning I bought and sold horses. Well, I still buy and sell horses. I still ride. You can see me up there torturing my horses. PETA comes and complains because I weigh too much, but I just run. This is a YouTube video that talks, and it's a PBS special. It's a horse I bought. It was a Mustang from the Mustang Rescue, and she became quite the star, if I say so myself. But PBS did a little special about it, so if you're ever interested, you can watch that. Now let me tell you about my cases. So one case, this is a case that relates to my horse activity. So I have 2 horses for sale right now. One is an excellent horse for a young rider. She's tried and true, 11 years old, really quiet, super easygoing. And she's nice, but she's not beautiful or super fancy, but she's a wonderful, reliable horse. I also have this other horse who's younger, got imported from Europe, and he's super fancy, but he's not that ready yet, all right? So I don't show people horses. I have a trainer who does that. My trainer shows this young woman who's a minor, 14, 15 years old, and her parents who don't know anything about horses. They show them the horse that I advertised, like, this is the horse for you. And they look at her and ride her, and she's good. And then, and I wasn't there, so I don't take credit for this, but my trainer says, well, there's this other horse, do you want to see it? I don't know what she was thinking, but anyway, they rode this young horse, and he was good for them at that moment, but guess which horse she wants to buy? The pretty horse? Now, and I'm not bragging, but the horses are expensive. So this horse is a $50,000 horse. They want him. What do I do?
maybe go out and those pie tins?
Mm-hmm.
I'd go, shake that around the horse a little.
And see what happens.
Yeah,
But
do a little
then,
experiment.
but then I've done something to get her injured. You're an attorney, Don. What do I do?
Don't let her ride it.
Well, what do I do, Don?
You sell her the horse?
Sell her the horse, and then and Don, would you write like a disclaimer saying, "You buyer beware, as is. Anything that happens to you is your problem." Da 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 da.
100%.
Okay. Anybody else? Come on, help me out. I sang for you guys. You would sell her the horse? You wouldn't.
I would not.
Why not?
I've had horses.
Okay. So you know how bad they can hurt you.
Oh, yeah.
Yeah. So you wouldn't sell the horse?
Not to her.
Okay. You've already gotten a gift. I can't give you another gift. All right, but thank you. I did not sell the horse to her. So I told her, I'm sorry. I told her, I ethically can't sell you this horse. And you know what? This talk probably helped me be able to make that decision. So now I need your help on something else. I want examples. I want examples of the most heinous crime. Pam?
I've got several. Your talk has just really inspired me to think of all of the gray areas. One is the Gulf War.
Yeah.
With the water trucks.
Yeah.
That brought in water, but they were low on fuel tanks. So they put fuel in the
water.
tanks. And then they put water back in the water tanks for the showers
For people?
for people.
Okay. Wonderful.
that?
That's terrible. But I want a terrible crime, like a crime that is the worst in the world. Go ahead.
Medical malpractice, misuse, whatever you want to call it.
Okay.
Unknown hospital.
Okay.
And the patient was supposed to have a hip dysartic.
And?
And the resident did it.
Oh, okay. So these are terrible, but we're not getting terrible enough. I want more
this was-
terrible.
You didn't see it.
Oh.
This was not here.
Oh.
This was up here.
Oh.
Huge, gaping, open, no way to
Oh.
close it. Pull,
Oh.
cut up into, worst
Okay.
thing I have ever seen.
All right. Oh, he died from it.
Oh, yeah.
Okay, we're going to
Yes,
keep
yes,
that
yes.
one then. We'll keep that one.
Yeah.
I need another crime. Kristen, it can be a crime, like you go to jail crime. Anything.
Just murder.
Murder? Okay. Why don't we say murder of a whole family? Okay. Who are good people. Another terrible crime. Can you help me out, Aaron?
Murder of a child.
Murder of a child. Okay. A rape? Do we have a rape? A rape? Child molestation?
Your Nuremberg trials,
Yeah.
I think some of that still happens.
That is.
Yeah.
In fact, you know, Operation Paperclip?
Yes, I do.
Operation Paperclip, some of the Nazi doctors who have been committing atrocities were allowed to come here to continue them. But that's another story. So I've got a situation. I'm operating on a patient. It's a 2-part surgery. I've done part 1, just normal. Our normal protocol is he'd go home, come back, we do part 2. But between part 1 and part 2, he's arrested for doing a terrible disarticulation of a hip, rape, murder, whatever. Now he's scheduled to have second part of surgery. And I'm getting a call from the prison about, are we still doing the surgery? Don?
I've been wrong every time I've answered.
No, this is ethics. You can't be wrong. It's just a difference of opinion. What do you do, Don?
You give me the scenario again?
So I agreed to do a 2-part surgery on a person. After the first part of the surgery, unbeknownst to me, he's now arrested for disarticulating a hip, raping a good family, child molestation, and the Nuremberg stuff.
Yeah, I think you have to finish the surgery. I mean, I think you've started the process, right? And you're not treating him based on his ethics. You're treating him based on him being a patient that's come to you to fix him. You've already done part of the surgery?
Don, you wanted me to sell a horse to a little girl, a 14-year-old who's gonna die.
Her parents will take care of that.
Oh, Don, you are killing me. You are all over the place, man. What is it? Yes.
I agree with him though, but I think because you're doing this surgery based on your ethics,
Yes.
not on the patient's.
What if they didn't do it?
Oh, so you're saying the accusation's not enough?
What if it isn't?
So he might be misidentified.
And then you didn't do the surgery, and now he's suffering.
Now he's suffering
because
because of me. Because of our pillars, autonomy, non-maleficence, beneficence, justice, I don't really have it out.
Isn't the same thing as attorneys, which is everybody deserves representation regardless of it. I mean, that's what public defenders do. You know they did it
Yeah.
in some cases, but
Yep.
they still deserve representation. Doesn't the patient still deserve
Okay.
treatment?
Well, go ahead.
I had an experience rotating through the ER, and there were several gate members that came in with gunshot wounds. And the doctors would say, oh, we saw him last week and last month, and they still had to patch him up. They were not there to judge, they were there to do their job.
Yeah.
So, but it does make you wonder, why are resources being used there when other people are going without health care?
No, these are all good points, but I'm going to do the surgery. But no, thank you very much. This was wonderful. I know this was a small crowd, but it was fun to give a talk where you could really let your hair down, even though I have none. But I really thank you. Questions? Comments? All right, well, we're done.